Hello, everybody. It's me, Sam, the pain and performance expert here at Sheffield Sports Medicine. It's good to be live again this week, and our topic this week is knees or knee pain, basically in general, and it's something actually we see a lot of here at clinic. In fact, I'd arguably say it's probably the most common thing we see is knee pain, coming very close with back pain. But knee pain is something we see a lot of, and something that I've experienced a lot of, not just personally, but also in sporting environments when I've worked for football, rugby, boxing clubs, all sorts. So it's something that I'd like to say that I know a lot about. And like I just said, I have actually experienced knee problems before. So I will just give you a quick insight to what has happened to me. So I have had a ACL rupture. For those of you who don't know what an ACL rupture is, basically an ACL is a really important ligament in the knee, right in the center, and it stands for anterior cruciate ligament. And its job is basically to stop the bones at the bottom of the knee kind of moving. All right, and people who have got these ruptures have a lot of pain. There's a lot of swelling, and most problematic thing is actually the feeling of giving way itself, so the instability of the knee. So I personally had this injury, and I've had my surgery, I've had it reconstructed, rehab myself back, and now I'm pretty much perfect. I can't complain. I can do absolutely everything that I can think of, which is great. So we've got some interesting questions for knee problems and knee pain today. So we're going to go through these. But first off, let's just think about the knee itself. So when we look at the knee, there's a few important structures to think about. And obviously the ligaments, all of them are really important. The most important ones are your ACL, the one we just talked about. You've got your LCL, which is the one behind it, lateral collateral ligament, medial, MCL, and ACL, PCL, posterior, sorry. I nearly forgot then. PCL, so posterior collateral ligament. So you've got LCL, PCL, ACL, MCL. And they're all collateral ligaments. It's just anterior, medial, lateral, posterior. Okay, so they're the really important ligaments that we need to look out for when we're looking at the knee, because these are the ones that can be damaged. More medial and anterior are very common. You also need to look at meniscus, so meniscal problems. So this is the cartilage in the knee. This is probably the most common structural issue we see, and that's the cartilage. So meniscal tear, we see that quite a lot, or just damage to the meniscus itself. And then you've got the tendons and the patella, really. So patella can sometimes rub, and the tendons below it and above it also can become inflamed. You get tendinopathies, and that's your quadricep tendon and your patella tendon. So these are the structures that you need to look for when we're looking at the knee, simplicity anyway. And they're the ones that usually have issues. All right. But one thing to remember is that the knee itself is usually a victim. All right. And there's usually a reason why you're getting either chronic pain or it's just given way and gone. All right. Don't get me wrong, though. Accidents happen. Playing football, you can get tackled from the side and snap, there goes that ligament. Okay. But when we're looking at chronic pain, usually the knee is the victim, and we have to find out why it's loading, why we're getting pain there, what is causing that. And a really interesting story is we had this patient once, and he had knee pain just in his left knee, not in his right. So he went to the doctors, and they said, "Oh, you've got arthritis in your left knee." And he said to the doctors, "Well, my left knee is 70 years old, my right knee is 70 years old. So why has my left knee just got arthritis and my right knee hasn't?" And he put it perfectly. And there'll be a reason for that, because that knee is loaded for a long period of time, and therefore it's worn. So the actual problem probably hasn't been addressed, and therefore the load has gone to the knee, and that's why it's worn. Okay, so we've covered a little bit about the knee. So let's get onto these questions then today. All right, so starting off is, why does my knee give way? So this is a very, very good question, because I know a lot of people, or a lot of people who know someone who suffers from this. And the knee giving way can be all sorts of issues. Okay, so anything that causes instability in the knee, we have to basically find out if it's a structural issue or not. All right, if it's not a structural issue, that's probably the better thing, because it's easily fixable. Because it either means that the knee is isn't being supported by the right muscles, and the brain isn't receiving the right signals. So something to look at is like proprioception as well. Does the brain know what that joint is doing at a certain time? They're things to look at. However, if it is a structural issue, it is going to be meniscal or probably ACL, MCL, one of them ligaments. They've probably been compromised. All right, and that doesn't mean you definitely need surgery, by the way. All right, it could be fixed through alternative methods, such as physio, but it just depends on the severity of the rupture, severity of the tear, if it's a meniscal tear. But some people can absolutely just rupture their ACL and live without it. All right, and they don't need the surgery. And that usually depends on their lifestyle, what they want to achieve, what they want to do. So, for example, elite athletes usually would get their ACL repaired because they're going to be putting a lot of force through that anyway, and it usually is quite unstable. But obviously, yes, if your knee is giving way, it's definitely something to look out for, and definitely something to get checked out, because there's always a reason for that. It's either going to be like a neurological muscular reason or proprioception problem, in which case, like I say, it can be easily fixed, or it's going to be structure problem, and it's either going to be the meniscus, so the meniscus is torn, or it's going to be a ligament problem, ACL, MCL, that have either stretched because they've been torn, or they've completely ruptured, and it's creating instability in the knee, and therefore the structure isn't there anymore to actually help that knee. But like I said, sometimes you don't actually need surgery, and it can be done through alternative methods, but it's definitely worth getting checked out if your knee's giving way. Really important, because the last thing you want to be doing is competing or doing, walking, running, whatever it may be, and your knee gives way, and that's it. All right, because one, you can make it worse, you could cause more damage, or you could hurt yourself elsewhere as well. So if your knee is unstable and giving way, it's definitely something to get checked out for. But like I said, it's either going to be a neurological proprioception problem, or it's going to be a structural issue which needs addressing either way. Okay, so thank you for that question. So moving on to, why can't I straighten my knee? All right, and this is a good question. So it depends what you mean by straighten. Fully, I'm guessing what this person means is they mean full extension. So full extension of the knee. So can the knee fully straighten out? And there's two things to look at here. There's a lot of questions that I would like to ask you personally. But one thing to always take into account is your age, your lifestyle. Okay, really important, because we have to work out if that blockage that's stopping you straightening your knee is muscular or is it structural. Okay, so is the muscle just struggling to contract and actually straighten that knee, or is there a blockage? All right, if there's a blockage, then it's a structural issue. So it's either going to be severe osteoarthritis, it's going to be osteophytes being grown and causing a problem, which is basically just extra bone forming. So it's really important that you have a look at that, get that addressed, because it'd be important to find out if it's structural or not. If it's structural and it's really, really bad, it's going to be a long road. It's going to be hard to fix, especially if you've had it for a long period of time, because the longer you have something, usually the worse it gets. If it is arthritis, then it'll be also probably hard to flex it as well. There'll be a hard end range feel at extension, at flexion of the knee, and that may cause some issues in terms of pain, and it may require a knee replacement if it's gone that far. But like I said previously, there's always a reason why this happens, and if it's got that bad, there'll be a reason for either previous injury to the knee area, hips, ankle even as well, and unfortunately the knee's just taking the load, and over time has worn. So if you can't straighten it, go see someone. All right, because it's either going to be structural or it's fixable. Okay, even if it is structural, can be fixable with certain techniques, but it just depends on the severity of the arthritis, if it is arthritis, or the structural problem itself. Because sometimes, going back to meniscal tear, if you do a bucket handle tear, meniscus, so when you tear the cartilage in your knee, there's a few ways it can tear. One's called the bucket handle. Usually when this happens, bits get caught in the joint and they can lock the joint. So if you're suffering from giving way and locking, chances are you've done your meniscus in, and it's going to have to be operated on. Okay, pretty easy operation, just keyhole surgery. I've had it done along with my ACL, and it's not that bad. But it can cause problems down the line. Just depends. Some people are fine, some people are not. But make sure you do physio after if it is. But going back to the point, if it is locking and can't straighten it, then that would be a sign of structural debris, damage inside the joint, and it's causing issues for flexion or extension of the knee. Okay, great. So how can I tell if I have osteoarthritis in my knee? So we kind of just covered this actually, but good question. Something we see a lot of. So it's going to be a limited range of movement in the knee. Okay, so you might not be able to fully straighten it, you might not fully bend it. Most likely it's going to be both, which could mean the degeneration there. And if you get someone to test it and they start trying to pull it through that end range, is there a big hard blockage? If there is, that's usually a sign of arthritis there. So that's how you can tell. There will also be obviously pain with that and inflammation as well. So it could be quite hot around the joint. There could be a bit of swelling as well. All these signs would point to maybe arthritis. But again, you need to ask yourself why. Why is that joint loading so much? And if we can stop it loading, does that reduce your pain? Does that increase your range of movement? If so, that's a really good sign. Because worst case scenario is the arthritis is that bad and that painful that you've got hardly any range, you can hardly walk, and it may be the road for a knee replacement, which is obviously the last resort for anything, but it's definitely something to think about if it is that bad. Or alternatively, there's injections that you can have, steroid injections, Ostenol, etc., which may help relieve that pain, increase range of movement in the joint. But if it's severe, it's not looking good. But like I said, it's just about finding out why has that joint loaded. If we can address that and it reduces the pain and increases the range of movement, it's a really, really good sign. Okay, great. Moving on, what should I do to recover from knee surgery? Okay, so it depends what type of surgery you've had. So if you've had, like me, a full ACL reconstruction, it's a long road, all right? Usually we give people about a year to recover. Athletes, 9 months. But when I had it, I was determined to do it quicker than 9 months. So I actually returned to sport within 6 months, which is very fast. And I don't think most people will be able to do that. And looking back at it, maybe I did it even a bit too quick. Luckily, I was fine. Nothing happened. Didn't re-injure. But yes, I just put my heart and soul into rehabbing. And that's a really important thing. As soon as you've had your knee surgery, it's really important that the first thing you look at is range of movement, getting that range back, getting extension in the knee, number one, then flexion, all right? Because I've seen it so many times, so many people that have had surgery and they haven't done their physio, they haven't increased their range of movement, they haven't forced extension and flexion of the knee, and now they're stuck and they can't fully straighten their knee, they can't fully flex their knee, all right? They're just stuck there now because it's been so long and there's just so much scar tissue, the joint's just healed in that way, and unfortunately they're probably going to be stuck for a while, or it's going to be a long road of recovery anyway to get that range of movement. So one thing is really important: if you do have knee surgery, please do your physio. Make sure you work on that range of movement. As soon as you've got flexion, extension back in the knee, full range, you're doing well, really well. All right, and then you can look at strengthening stuff. Okay, but yeah, foremost, do get your range of movement back in that knee. Really important. Okay, great. So that's how you recover from knee surgery. Improve your range, get your range back, then everything else should fall into place. Another thing actually probably to mention is don't jump back into things too quickly. Re-injuries can be quite high in the first few months, so really be careful with that. All right, next and last question actually. What exercises can I do to help improve my knee stability and strength? Okay, good question. So number one, squats. Who doesn't love squats? All right, so squatting is really important. I think I mentioned this before. There's research out there to show that actually squatting and being able to squat as you grow older will actually improve your quality of life and make you live longer. So people who have shown to be able to squat later life live longer. So it's really important to just be able to squat anyway. And especially with load, I would highly recommend that most people should be able to squat their body weight. If you can't, work your way up, get there. It won't take you too long, I promise. But you should be able to squat your body weight at least for one. And elite athletes should be going for 2 times their body weight. All right. So that's how you actually improve your knee strength and stability. Apart from that, there's obviously other things, split squats. But most important is actually probably stability. So looking at balancing on a Bosu ball, doing one-legged balance while catching things, looking at proprioception as well. So because stability in the knee is really important, and how you can actually perform on that knee is key to health. All right, can you jump and land without hurting your knee? Can you jump in different directions laterally and be stable on that knee? If you can, that's really good. If you can't, it's definitely something to be working on, because you want to be robust and you want to be strong in every range, no matter what life throws at you. And that's one way to do it, is actually practice. All right, go to the gym, do things where you would be uncomfortable to do, in the sense, obviously don't overdo it or injure yourself, but do things that are tough and hard, because the better you get at it, the easier it will be in everyday life. So that's what I would recommend for